In the heart of Yorkshire,
Hello, emergency department.
an unbeatable team.
That way.
And stop, we're going to lay you down.
Hard at work 24 hours a day,
Does it count as a daily exercise?
7 days a week,
I can smell it now. It's a really bad burn.
saving lives,
It might be that we need to put you to sleep in order to try and sort this out.
helping loved ones,
It's a shocker, that.
making the community they serve better.
We got you, lad.
You're being such a good boy.
A health service treating anyone
Car door, house door.
Van door.
Big van door.
So it's quite impressive, isn't it?
and everyone.
Oh, you're going to have a good black eye.
Are you, doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it. I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed him.
On shift tonight, consultant Dr. Dave Walker,
All the IT's gone down, all the systems.
physician associate Adele,
Amazing. I didn't think you was going to get there.
and Dr. Emilio Giannotti.
Give me a good...
So, get ready to share a shift
Welcome to 1982.
with the team at Barnsley Casualty. It's not business as usual at Barnsley Casualty today.
His phone doesn't work.
No, it's not working.
Let's find Kelly first.
It's chaos.
So the servers apparently have no power.
Consultant Dr. Joe Stone
No, it's not. Yes.
and members of office management offer their services.
What's broken?
Everything is.
There's no one dealing with it.
There's nothing.
IT it down.
Dr. Walker comes to assess the situation.
And all these computers. Yes. None of the VDIs. None of the VDIs working. No, there's 9. Only onto the desktop.
We've had a bit of an IT disaster. All the IT's gone down, all the systems.
Because everything's down, we're going to have to give you a ring.
On reception, they're handwriting the notes with the patient's details on them. All the electronic systems we use normally aren't working. It's all Greek to me. Any idea what our wait is at the moment?
About 2.5 hours.
2.5 hours.
Give or take.
Okay. All our systems, all our patient tracking systems, all our blood ordering systems, systems for ordering x-rays, CTs, you name it, everything is down.
It's just painful, this. It makes everything so much hard work, doesn't it?
It's just... There's
no point standing there now.
Is the sweetie drawer working?
No.
Even the sweetie drawer's broken.
First time I'm here. There's one computer in reception.
You need to bring something here, Tracy. Don't come here empty-handed.
I am trying to sort it all.
Bring the wife.
Hello, emergency department. How long have you been? 5 minutes. Okay.
The IT systems might be down, but the doors are still open. Paramedics are rushing in a patient. 33-year-old motorbike courier Marius has had a head-on collision.
Hello.
Sister Kim meets the paramedics in the ambulance bay.
He has been driving through a junction at about 25-30 miles an hour when a car's turned to come across that junction and he's drove straight into front of it. Big 4x4 pickup.
So, motorbike.
Yes, motorbike versus big pickup truck.
So, injuries?
Fractured wrist, we suspect. He's got some left leg pain up top near his hip.
Dr. Eleanor Sim is taking charge of his care.
He remembers everything that's happened. He's not lost any consciousness.
So, was wearing a helmet, had full...
Helmet, full leathers, boots. We managed to get it all off without cutting it off.
Put you in?
So, he's had 10 milligram of morphine, he's had a gram of paracetamol, and had some Entonox.
Okay, we're going to get these blocks off. Someone's going to hold your head nice and still. We're going to get this board out from underneath you, and then we can have a little check and see whether there's any sign of any injuries on your head, any pain down your back. Okay.
Ready, steady, roll.
Well done.
So when I'm pressing here, any pain at all? No. Down here. And down here. No pain. That's fine. Just see if you can turn your head from side to side. Any pain in your neck when you're doing that? Fantastic. Let's have a little look at your arm. Any pain around your hand here? No? Yeah. Fine. So what we'll do, we'll get an x-ray of your fingers and your wrist.
Pop them back
Have you
under
had a look
for
at his fingers? Are they all...
Yeah, they're all there. It's just his ring finger. It's all come away.
Oh, yeah. Some pain on your middle finger.
Yes. Let me get some wet cotton.
And what about your
That's fine.
little finger? So it's just your middle and your ring finger? Yeah. Okay.
We're all finished now. All right. So they'll get you for your x-rays, no problem at all. And hope you get sorted, and I will come check on you later.
Before Marius gets taken for his x-rays,
Hello.
auxiliary nurse Kerry and nurse Hari Haran are here to administer pain relief.
This is going to give you some
morphine.
To leave the pain. This pain is tolerable or
Yes.
manageable, right?
With his pain now under control, Marius is taken down to radiology. If he has broken a bone, he may not be able to go back to work for 3 months. In the hub, the IT system is still down.
No bones, lady.
But the emergencies still keep coming.
We're going. Cardiac arrest.
Advanced clinical practitioner Chantel comes to resus.
I can take it. Listen, I'm free.
I'll come and help you, Gemma.
When you've worked in A&E quite a long time and you're quite experienced within emergency medicine,
Get a syringe just in case I've got to go fem.
you flip into a certain mode and you know what needs to be done, and you become this team that works together, divides roles for that shared purpose, is to save a patient.
Ready, steady, move. There we go. So this is a 66-year-old female who at 10:25 this morning collapsed into a witness cardiac arrest after complaining of being unwell and blue at the lips. She has had ×8 adrenaline and 2.5 litres of saline. I believe the underlying cause of this arrest is an internal hemorrhage. She's been recently in hospital for an internal bleeding. It appears to be sort of gastric. The other thing is that the patient has retained a very good ETCO2 throughout, and until recently a very good waveform, but still quite a slow PEA.
I'm waiting for compression to get a pulse.
Pausing for rhythm check. Pulse check, please.
When you get exposed to a cardiac arrest situation, you have to think clearly and rationally. It's a life or death situation.
You just get that ultrasound away, and then I'll get a peripheral cannula in that arm.
In resus, the team are fighting to save a woman's life.
Can anyone listen bilaterally for air entry, please? Anyone with a stethoscope?
Can anyone check for a pulse, please?
I can't feel a pulse.
Okay, do you want it to continue? When was your last adrenaline?
So the last adrenaline was about 15 minutes ago.
Okay.
So airway-wise, we've got an ET tube in situ.
Are you on timing, Katie? Or we do another check? Can we do another rhythm check, please?
Gemma, I've got a blood gas. Can I have them bloods? Thank you, sir.
This lady has pretty much been down for almost an hour now. There has been a brief period of Rospinol, despite good CPR, has now gone from the initial shockable to PEA to asystole. We will wait for this gas result, but my thoughts are that actually, unfortunately, this is now futile. I think seeing someone knowing they're going to die, it does affect you. I think we'd be wrong to say it doesn't. Can we do another rhythm check, please? But to function in that cardiac arrest situation, there has to be some protective mechanism so you can think clearly and rationally. I think what becomes easier for us to accept that death as a team, and that's something that's discussed in a cardiac arrest, is that if we're all in agreement, that's a better situation than surviving and being in a terrible state.
I'm afraid this attempt is going to be futile, and I think we should stop.
I agree. Yeah.
Are you happy for me to stop the compression?
Yeah.
CPR ceased at 12:10.
I think we all deal with death really differently and personally in A&E, and as traumatic and as upsetting as it is, we still have a job and a duty to all the other patients in the department and to keep everyone safe.
The team at Barnsley Casualty are dealing with an IT nightmare today. And they're going back in time for the solution.
Ladies and gentlemen, welcome to 1982.
Everything's down, not working. And yeah, so we're back to old school, writing on a whiteboard.
Are they big enough, them boxes, Chantal? Do you want me to make them bigger?
Those of us who've been doing it for a while, we've used it, but the digital natives, they struggle a little with the idea of just writing things down on a piece of paper or on a whiteboard.
Oh no.
Oh my God. That's why it weren't working.
Do you know what? This is not the first time we've had this out. Oh, for God's sake.
So instead of a computer, we've now got a board, and this is a kind of map of the department. So all the locations, resus, majors, waiting room, we've mapped all that out, and we just write the patient's name in the box.
Can you please do me a favor? Can you populate that accurately? Who is where, put names in, please. Yeah.
Up until probably, certainly about 15, 20 years ago, this is how we used to run EDs.
We'll get you the and then ADC 1 and 2 at bottom, that's it, love. Yeah.
Where's Resus? We haven't done Resus.
Yeah, who was one of them for Resus?
While the team get to grips with the new system, earlier this morning, motorcycle courier Marius was involved in a serious head-on collision.
Hello, is it Marius? Yes. Are you all right?
He's about to get his wrist and leg x-rayed to see what damage has been done.
My name's Matt, this is Hannah. OK, we're just going to do a couple of x-rays. Is that all right? Yeah. We're just going to start with your hips first. Yeah. You just need to keep nice and still for us if you can. OK.
We'll have a look at your x-rays round in A&E and let you know the results, all right?
A worried Andrea, Marius's wife, is waiting in cubicle 4.
Huh?
C'è. Uffiucca. Io ho stato. Non so, io girate poi. Vuole ci credo se sti. Oh, so male. Non so mai cosa. I was actually going to take my module 1 test. So I can get the proper motorcycle driver's license. I was on my way. And I got hit right in front of the police station in Roma. I don't know if it's a sign or not.
Marius's x-ray results have been assessed by orthopedics. He's got a fractured wrist and broken his middle and ring finger. Consultant Saeed Khan comes to discuss the next steps.
So the position now is quite bad. Okay, it's displaced, the bone is not in alignment. So we'll give some Gasamer so that we don't have pain, and then we're going to try and pull it a bit.
The longer Marius's wrist is left unaligned, the greater the risk of nerve damage.
Okay, thank you.
After being put back in place
And everything ready for you.
And plastered up,
And I didn't cry.
He's feeling a lot better. Marius's right wrist was operated on. He now has metal plates holding everything in place. He hasn't been able to work since, but hopes to be back soon. Casualty's IT system might still be totally down, but that isn't stopping new emergencies coming in. Paramedics have arrived with 7-year-old Oscar after an accident at school. Sister Kate takes some details before speaking to Mum Kimberly and Dad Phil.
So, paramedics just said that he's got flashed into somebody else, sort of retched, and then lost consciousness for about 10 seconds. Weirdest face.
Yeah, I was quite concerned because like his lips had got like grey blue and...
Am I alright just to check his obs? I'll just pop in this one. So if you just pop your bum up on there for me. How are you feeling?
Good.
Does your head feel okay? Yeah? Can you pop your finger in there for me? So Mum and Dad had to come out of work?
Yeah. Daddy said he was eating half of his sandwich, but then he had to come to get me.
So he's had to leave half of his sandwich?
That's scary, don't you get like when you see school coming up on your phone, you're
yeah.
like, oh no. It's always you, isn't it?
Yeah.
Look at your brother, it's always you.
Try and keep that arm nice and still. And then last one, I'm just going to look in your eyes if you look at my nose. They're lovely.
Every day.
Okay, it's lovely. Right, so if you go back through there for me, and we're still just waiting to see the doctor.
No, it's fine.
Is that all right?
Yeah, thank you.
The effects of a head injury can take a while to occur and can be devastating. So the team need to keep a close eye on Oscar. Back in the hub, a plan is beginning to come together. And Sister Kelly has been nominated to run it.
When this is done before, we've gone to the lead nurse and said, oh, do you want me to see you next? And the lead nurse has managed the coordination. So we have to plan out the department on a whiteboard with the cubicles and the patients' names, and it can be quite time-consuming and taxing, and there has to be a lot of communication with one person in charge and overseeing everything because it can become an absolute sham, and again, dangerous. Does that make sense? So you're managing the whole department, because if there's too many people, then we don't know. Asim, all doctors need to go to Kelly. So, like, whoever's next to be seen, Kelly needs to manage the whole department.
When they're seen, do they need to tick next?
You write what time you pick them up. You write what name, your name and what time you pick them up. X-rays are going here.
Yeah. Oh, again, old school.
It's just all old school.
Very old school.
The department coordinator, Tracy, takes on the task of adding which patient is where.
Yeah, well, yeah. I'm not allowed to use Tracy's pen because my writing's terrible, apparently. So.
I need a coffee. I need a coffee.
Well, we're not aware we've lost anybody. Well, that's because we're not aware we've lost anybody. So have you been around the cubicles? So the pod's working, the clock's working. Tracy's working. Your pen's working. Yeah.
As the team makes sure they have a clear idea which patient is where, in cubicle 9, 59-year-old Andrew has been brought in by his little sister Alison with severe abdominal pains.
Breathe in. On and off.
Triage has sent him straight into Majors and have called a surgical doctor to come and assess him.
I've got abdominal pains, and it started at the left, then it went into the middle, now it's gone across to the right. And my sister used to be a nurse, and she had a nagging doubt that it could have been, what did she say?
Appendicitis and/or gallbladder.
Andrew has spent his fair share of time in hospitals over the last 20 years.
I had an accident in the coal mine. I got crushed by a diesel locomotive. As it came by, the draft, it took my jacket, which got caught on something and sort of spun me round, which crushed me up between the locomotive and the wall. And I got 5 fractures in my pelvis, a broken left femur and a crack on the skull, you know. At that stage, they didn't think I'd walk again.
Luckily for Andrew, he did make a full recovery.
Are you allergic to anything?
No.
While he waits for the doctor to see him, Nurse Rena arrives to give him something to ease the pain.
Is that all right?
Yeah, that's fine.
So, are you okay to take this tablet now?
Yes.
This is codeine.
They don't taste as nice as paracetamol, do they?
Have you got any pain over here?
No.
I pass this buzzer. If you need any help, just press this buzzer, okay?
Right.
I might help you.
Okay, that's lovely.
You want me to leave this vibrating?
Yeah, you can do. Yeah, that's yeah. I'll try not to fall off.
I just want you to fall.
All Andrew can do now is hope the pain eases while he waits for a specialist to see him. In Bay 3, 75-year-old Alan has been rushed into resus. With him, his wife Judith. He has severe breathing problems and suspected chronic laryngitis. Dr. Phil Taylor is in charge of his treatment.
Hello there, sir. Is that Alan? Hello there. My name's Phil. I'm one of the doctors. So, what's brought you in today, then?
I came in by taxi this morning because a fortnight ago, just over a fortnight ago, I had the same bad breathing. I couldn't breathe so well, and you know, worked on me and brought that down. And there was a slight COVID infection. And then when I was released home, he had advised me if he gets comes back again.
All right. And I was having a little look at your notes earlier, and you got laryngitis, isn't it? And
Yes.
you were in about 2 weeks ago.
That's
with,
right, yes.
With COVID, and that's kind of kicked it all off a
That's
bit.
right, yes.
All righty.
It'd be frightening as well.
Yeah, I bet.
When you can't breathe.
Yeah.
Yes.
And prior to you having COVID, what was your breathing like normally? Was it this raspy?
No.
No?
But I had difficulty at times,
Okay.
you know, with my breathing.
All right.
But,
And then since you were discharged, have you had any symptoms like productive cough?
oh yes,
Yeah?
yes.
All right. And what colour is it when it's coming up?
Dark, creamy coloured.
Okay. So what we're going to do, I had a look at your previous treatments that you had with the ear, nose and throat doctors last time. I'm going to give you that same set, so some nebulised adrenaline, some antibiotics, and then the ENT doctors are going to come and see you in the resus here now. All righty.
Fine, thank you, Doctor, yes.
Have you got any questions?
No, none at all.
No?
Quite happy.
Thank you. All right, we'll get you a treatment so we'll get you feeling a bit better. All right.
Lovely, thank you.
Alan's already had a chest x-ray, which he'll soon get the results for. So while he waits for the ear, nose and throat doctor, Nurse Amy arrives with a nebulizer to try and stabilise his breathing.
Right, Ellen, my love. You've had adrenaline nebulizers before, haven't you, darling?
Yes.
Just tell me your full name and your date of birth.
1948.
You cheated then, you looked at it.
Oh, did I?
I'll let you off.
We've given Alan a nebulizer because from the bedside I could hear that he was wheezing. So what that means is some of his airways are narrowed compared to normal, and so you can give him medication called salbutamol, which helps open up these airways and hopefully should increase the ease of his breathing.
You're not allergic to anything, are you, love?
No, not really.
Fabulous. Do you want to pop that mask on? You know how it goes, don't you? Nice and tight for your face. We'll just tighten it a little bit. Is that all right?
Yeah, perfect. Thank you.
Fabulous.
With the narrowing of Alan's airways, less oxygen is likely to be flowing around his body.
Gonna pop your antibiotic in, all right, sweet?
Yeah.
So it's essential they widen them before his oxygen levels become dangerously low. This morning, Barnsley Casualty's entire IT system has gone down. So it's a trusty whiteboard that's saving the day.
They're not putting what time they've booked in.
I know, I've told them they're doing it
So
now.
how do I know?
They're getting an
Time order.
It's just very basic. Everything just gets written down. It does work. It does work because we bring in extra people to help. But it is more work for the staff. It is a headache. It really is. That's working, is this? Nothing else. I've just tried to log in again, and it's still not working.
And things seem to be going from bad to worse.
So we can't view X-rays now either. So we may have to go back to printing the old X-rays. But although we don't have the boxes anymore, the light boxes that we used to hold them up to. So
As Dr. Walker and the team deal with their next big problem, in cubicle 9 is 59-year-old Andrew, who came in with severe abdominal pains. Registrar Dr. Gaurav Parwar and Dr. Natalie Chan from the surgical department arrived to see him.
Hi, Andrew. I'm Gaurav. I'm a surgical registrar.
Okay.
And my colleague Natalie here with me.
Hi.
How are you both?
Well, apart from being in here.
All right.
Yeah.
How did it start?
Okay, about 3 a.m. yesterday morning, I woke up and it was, I said to Alison, it's the mother of all tummy aches. It was on the left side there, and there was a stabbing pain, like under the ribs there.
Okay.
And this morning it was in the middle behind my tummy button. And then as the day's gone on, it's moved across to this side now.
Okay.
And it's like toothache in your tummy. But if I change position or take a deep breath, it's a sharp stabbing pain.
Okay. Have you had this pain before, or is this the first time?
No, this is the first time.
Never before?
No.
Along with this pain, did you get any temperature, any fever, hot and cold, sweating?
Well, I didn't think so, but the doctor said the temperatures when I came in were high.
Okay. Any nausea, vomiting?
No.
No? Opening your bowels fine?
Yes, yeah. It's a very, very pale colour. Almost beige in colour, you know.
Yeah, that's very okay. And urine, is it dark?
It's a bit darker than normal, yes.
Yellowish, okay. Okay. Can I have a feel of your tummy?
Yeah, of course you can, yeah.
Okay?
Yep.
All right. Now point with your one finger where the maximum pain was. There. Okay.
I think it's there, yeah.
Yeah, all right. Anything on this side?
No.
Nothing at all?
No.
When I'm pressing? Anything here?
No. A little bit there.
Here.
Oh!
I'm sorry for that.
No, sorry.
Here, yeah, maximum. Okay, all right. Okay. I saw your blood tests.
Yeah.
Your bilirubin is high. Alkaline phosphatase is high, which is showing that there is some block in the pathway of bile flow from gallbladder to the bowel.
Right.
And that's exactly when you see this profile, this picture of liver tests, yeah?
Yeah.
Also on your blood tests, your white cell count is very high. It's 17, which should be it should be between 4 to 10. Yeah.
So is that good? Is that because my body's fighting it?
So it's basically sign of infection and inflammation together, okay? I think there is some blockage. The commonest reason is a stone when there is pain and there is deranged LFTs, that is liver profile tests. We need to see if you got any stones in your gallbladder. Mostly you might have, and one of the stones might have slipped into the tract which connect your gallbladder to the bowel.
Yeah.
Okay, what we need to do is we need to keep you in, okay, because this is mostly, we call it as acute cholangitis, which is a very delicate thing. We need to manage with IV antibiotics, IV fluids. You can definitely eat and drink.
Thank you.
Oh, perfect. Just take care.
Yep. Can I sit up again now?
Yeah. Oh, sorry. I'll just pull it up. So.
You're insured.
Yeah.
Thank you.
Okay.
That's better. Yeah.
Thank you.
Take care.
With a firm diagnosis, Andrew now needs to wait to be taken up to the surgical ward. And it seems like his sister Alison still has her nurse sensors.
Yeah, I got this one right.
Yeah.
Yeah. Yeah, I could probably do the operation if I push him round to theatre and I remember how to do it. I could probably get his gallbladder out, yeah. I did misdiagnose my dad's broken ankle, though. Poor man.
So, here we go.
Andrew made it home not long after and is waiting for his operation. In the hub, the IT blackout has still not been fixed. Dr. Walker is getting more and more concerned.
Problem is, the longer it goes on, because our attendances go up quite a lot in the middle of the day. So we need the system back on before our big numbers start arriving. When you've got up to 100 patients or more in the department, they're going to different departments, they're going to X-ray, they're going to CT, some of them are going to wards. So yes, it is really tricky to keep track of every single patient. Those are time arrival.
Their arrival time.
But their time picked up.
Yeah.
Fine. And we can't lose someone. That does matter.
Back in paediatrics,
Like a unicorn room.
physician associate Adele knows exactly where her next patient is. 7-year-old Oscar is waiting to be seen after an accident at school left him unconscious.
Hi, Oscar. Where are your shoes? Oh, fair enough. I think we've all got a bit of hot feet in this weather, haven't we? What socks have you got and anything good? Oh, Hulk. No, is it Hulk? Yeah, nice. I've already chosen my favourite one. It's the one with the unicorns. I think it's pretty cool. Wow. Do you want to hop onto the couch then so Mum and Dad can sit down? Hang on, let me put the sheet on it first.
Where's this place on the wall? I want to know.
You want to go to it? Yeah, it's pretty cool. So, Oscar, my name's Adele. I'm one of the physician associates. And who's come with you?
Mummy and Daddy.
Correct. So, I heard you bumped your head. Yeah? Do you want to tell me what's happened? Can you remember?
I bumped my head into my friend.
Okay.
It's because I was turning around.
Yeah.
I didn't know he was behind me, so I walked forward and I banged my head with him.
Okay, so then what happened next then?
I had a nosebleed and...
Okay.
His nose was bleeding, wasn't it?
He said it went a bit foggy, and I think the children had realised that it was a bit worse than just a bump, like what they would normally get at school.
Yeah,
so
yeah.
They took him to the medical, which kids can go to, and the teacher at that point had like slumped down and he'd he'd passed out, lost consciousness, and his lips went all blue and grey.
Okay.
And he wasn't actually sick, he was like heaving to be sick 'cause he'd had his dinner.
Yeah, yeah,
so I think it just shocked him and worked him up.
Yeah.
When we got there from work, you were out of it really, weren't
Yeah,
you?
it was away,
really
but it was
lethargic,
very
couldn't move his arms.
So you came in an ambulance. Was that cool?
Yeah.
Yeah? Did it go very fast?
It sounded like it was really bumpy too.
Bumpy. Okay. And were you in PE doing this, or were you in the playground?
No, PE's on Wednesdays.
Oh, sorry. What was I thinking? And where on your head were you bumped? Can you remember?
I think it was here, but I'm not sure.
That's okay.
As with any head injury, a thorough examination is now needed.
Right then, should we do some funny moves?
Yeah.
Can you let your arms go like jelly for me? Wibbly wobbly jelly. Yeah? Jelly, jelly, jelly. Good stuff. Can you let your legs go like jelly? Super. Keep wobbling them. Excellent, well done. Okay, we're going to do some funny movements now. Can you put your arms like a chicken for me? Like this?
Yeah, I'm a chicken.
You're a chicken. Don't let me push you down. Stop, 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 stop. Good. Don't let me push you up. Good. Can you put your arms like a boxer? Don't let me pull you away. Good. Don't let me push you in. Good. Can you put your arms like you're riding a motorbike. Don't let me push you down. Good. Don't let me push you up. Good. Splay your fingers out like that for me. Don't let me squeeze them in. Fantastic. Give me a thumbs up. Don't let me press them down. Good. Excellent. Well done. Push this leg up for me. Push, 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 push. Push. Good. Well done. Let me give them a quick tickle. Find my pen. Have you got tickly feet? Have you? That a bit tickly? Yeah. Don't let me push your toes down. Oh, don't let me push them up. You have got sweaty feet, you're right. Super stuff. Okay, do you know your letters?
Yeah.
Right, can you go like this for me with one eye? That's it. Do you know what those ones are?
T, P, F, P, Z.
Amazing. What about that one?
L, D, E, F, C.
Super. Okay, these ones will be super tough.
E, T, L.
Yeah.
O, T.
Amazing. I didn't think you was going to get them. Okay. You've passed all my tests. You've done amazing. So, from what I've assessed, Mum and Dad, he looks excellent. Not got any concerns there. The reason why I was asking him so many questions is to make sure that he can remember everything that's happened before and after, which he seems to have done pretty well with, actually. There doesn't seem to be any blood behind his ears. Back of his head looks okay. He might have had a bit of a concussion from what's happened, okay. I'm just going to have a chat with my consultant, just with the lips going blue/grey, just a little bit more unusual. All good?
Yes. Yeah.
Do you want a sticker?
Yeah.
Yeah? All right, I'll go and get you a sticker. Best bit is giving the stickers. I've got some good stickers. Which one do you want?
Shiny orange.
God, that looks like you.
Oh yeah, with your glasses on, yeah. You want that one? You have been very brave. There you go.
Thank you.
You're very welcome, well done.
Oscar was given the all clear. and allowed to get back to his friends at school. 75-year-old Alan is still in Rhesus with wife Judith. He arrived this morning with severe breathing difficulties.
We only live down the road, and we just got rang to get a taxi to the hospital. And with my breathing problem, which was quite difficult, I got special process straight into Casualty.
Do you want to pop that mask on? You know how it goes, don't you? Fabulous.
Dr. Taylor's put Alan on a nebulizer with antibiotics to ease his symptoms.
You're getting anxious. You're tense. Your arms look tense.
Oh, hello there. Speak the devil.
Ear, nose and throat doctor Emilio Giannotti arrives to assess him.
How are you? We meet again?
Yes, again.
Good. Well, we're going to do exactly the same we did last time. We're going to have a look at your vocal cords, go down with the camera, and see how it looks like, okay?
Yeah, that's fine by me.
Good.
In Alan's case, we know that he has this condition, chronic laryngitis, so that is the most likely cause of his worsening symptoms. However, looking into the throat and into the nose will also look for other potential causes. So he could have inhaled something that's got stuck. He could potentially have a growth that's forming there and is blocking his airway. So the camera will help rule these things out.
You already know how this goes. It's basically the camera through the nose. You're going to have a look at your voice box again, see how it looks.
See, it's still there again.
So if you want me to stop, you just tell me. I'll take this all out immediately. Can I ask you to stick your tongue out for me? Give me a good E. Lovely. Puff your cheeks out for me. Lovely. That's it. Relax. And again, give me a good E. Thank you. Coming out. That would be all. Thank you very much for that. And sorry for the torture.
That was
all
a
done.
pleasure.
It's looking much better than it was compared to the last time I saw you. Not swollen, vocal cords are moving fine, and I can't see any lesions there or anything obstructing the airway, okay? So we're gonna have a chat with the medical doctors and see where we go from there. Good, if you need anything, let us know, we can come anytime. Bye.
With his throat all clear, that's good news for Alan. But until the team find what's causing his breathlessness, he's going nowhere.
Yeah, 2.5 hours. Yeah. It's not too bad really, that.
Right, he's next.
In the hub, the team are beginning to get the IT crisis under control.
When did he book in? Fine, so we've got a 2-hour wait, more or less.
5's going out to 19's.
But someone is going to be busy later on.
All the patients who've either attended or left during this period of time, they'll all have to have their files updated and...
I've got a picture. I know on system because some of these will have been on when we went down.
When it comes back online, all the admin staff are going to spend the whole afternoon updating where people are, where they should have been, and... Oh.
And there's a sense of hope.
We're told that the power problem's gone, but we're waiting for some of our systems to reset. So we were told half an hour ago that they'd be up in half an hour, so fingers crossed.
Dr. Taylor is looking over 75-year-old Alan's chest X-ray results. After a nasal endoscopy gave the all clear on his throat, will Dr. Taylor be able to locate the problem in his lungs?
So this was his chest X-ray about 2 weeks ago, and this is his chest X-ray today. Here's his heart, and here's his heart, and looking at both lung fields, there's no real focal changes, nothing suggesting any big nasty pneumonia. So, to be honest, this looks the same as it did about 2 weeks ago. But given the history, it sounds like he's got a bit of a chest infection anyway, because he's been coughing up a bit of mucky spit. But yeah, his chest X-ray looks okay today.
Dr. Taylor heads to Rhesus to tell Alan the news.
Alan, just had a quick look at your chest X-ray, and it looks absolutely fine. Yeah, we compared it to the one you had about 3 weeks ago, and it doesn't look any different, so I don't think there's any big, horrible pneumonia or anything like that. All righty?
Yes.
With no signs of a serious problem, the team feel confident Alan is suffering from a chest infection. A relief for wife of 33 years, Judith.
It is really, but I think he's better now, feeling that he's been attended to.
Marvellous stuff. Protocol, very good, everything 100%.
And Alan is all too familiar with the good care at Barnsley Hospital.
What was it you used to do as a job?
I used to work on the ambulance service.
Did you?
Yeah, 25 years.
Wow. Did you enjoy it?
I certainly did.
I bet you saw some fancy stuff, didn't you?
Well, it was one of those jobs that you had in them times in the 70s. But yeah, you were 1 minute, you was a doctor, then you became a midwife, and then you'd be a marriage guidance counsellor. You know, you'd got to step into all them jobs.
That's one thing I've not done. I've not delivered a baby.
I've delivered a few, yeah, about 6, I think, 6 babies.
Wow.
They'll be well grown up now.
Nice. What did you do, my love?
Well, originally, a long, long time ago, I was a teacher.
What came after originally?
Well, we were both involved in local politics.
Got my photograph on my mobile phone when she was the mayor.
Were you really? When was that?
In the mid-90s.
Hey, you've not changed a bit. Oh, wow. I couldn't carry that around my neck. I'd be fidgeting with it.
Alan will be monitored in Rhesus till the team have a bed ready for him on another ward.
Keep your phone
Just a
with you.
spot.
But I'll have to leave your coat here because I don't want to carry it on the boat.
That's right. Because I rolled it up, put it in the drawers.
It's a nice coat, it must have, you know.
No wardrobes.
Alan, how are you feeling now?
Oh, better, thank you.
Yeah? Good stuff. Does the breathing feel any easier at all?
A lot better.
Yeah?
80%.
Good. All right.
Fantastic.
Well, all your numbers are still looking good, so we're really just waiting for a bed on the ward now. All right.
What 6?
You'll be going up to the acute medical unit. Okay. Yeah, the AMU.
Fine.
Brilliant. All right, well, lovely to meet you.
Thank you.
All right, take care.
Yeah. Nice job.
Alan was moved to the acute medical unit to be monitored, but unexpectedly suffered from further complications. He was moved to intensive care, where he was put into an induced coma for 4 days. He's currently still in hospital, but is set to make a full recovery.
This is an improvement.
The computers appear to be stuttering back to life.
Hooray!
How come you can get on, Dave? Have you got priority?
Yeah. It's a special server for them, you know.
Special server for Dave.
It's working, I proved it with them, yeah. Are you talking about a piece of paper though for the...
Roughly about 2.5, 2 hour drop to work. For everybody that has been here, thank you so much. You've all worked amazingly. And I think we've done quite well, keeping on top.
The whiteboard is returned to its cupboard until it's needed again.
The fact that we've managed to keep control of the department despite all the difficulties with the IT systems that we rely on has been really, really impressive of the team.
Like most things in our job, it fits just about. All right.
I will be going home and having fish and chips with some. Well, I usually have Prosecco with my fish and chips, so that's what I'll be doing this evening.
As Dr. Walker heads home for his reward, Barnsley Casualty's always ready, 24/7, to welcome those in need of help.
And we're back in Barnsley next Monday at 9. And if you or someone you know has been affected by what you've seen tonight, organisations offering support can be found at channel5.com/helplines. Sifting through the evidence to unravel a mystery. The coroner establishes a cause of death, new on Wednesday at 9. Next tonight, shoplifters stripping the shelves.